So welcome everybody. Appreciate you being here today, this afternoon on the More Profit Community Pharmacy Roundtable. This is the mini version. We do an hour long once a month. This one we do each Wednesday at 4:30 p.m. Eastern Time, 1:30 Pacific. And so appreciate you joining us being here today. So my name's Breck Rice. I'll be one of your hosts along with George Veronis from Seniors Home Services. We'll be here to guide you through about 25 minutes worth of amazing information. So I'm super excited to share what we have to share with you. And just a little bit of my background. I've been with community pharmacy in that industry for now 22 years. Love the industry, do everything I can to help. I started with the old third-party solutions company. So most pharmacists know of TPS or third-party solutions. Unfortunately, that company got acquired by United Healthcare and rolled up underneath Optum. I signed on to help community pharmacies, not to rob from them. So I left. And when the opportunity arose, I started the new and improved third-party solutions company, which we call Serve RX. So that's my full-time gig, and I am one of the founders of Serve RX. But I've been preaching for the last couple of months actually a lot longer than that, to all our community pharmacy partners that you need to get more involved in clinical services. So if we want to go to the next slide, George, you'll see that I'm quite involved in a lot of things. One is PBM reform. So I host the PBM reform podcast on the Pharmacy Podcast Network. And I help educate a lot of not just the pharmacy industry, but even lawmakers about how the PBMs and insurance mafia is really aligned against our community pharmacy partners. And so we need to do something to not only change a lot of those policies, but a lot of the services that I talk about will bypass the PBM. So these are things that would bypass to bring in more profit for pharmacies that cannot be touched by the PBMs. And so that when George approached me and said, "Hey, you need to see about seniors home services," I got super excited because we have been trying to get our pharmacy partners to be more involved in clinical services. But I know there's used to be a pretty hefty cost to get credentialed and set up to do medical billing. Those credentialing companies would charge anywhere from 16,000 up to one client of mine spent over 50,000 and still couldn't get across the finish line. So I knew there needed to be a better way. So when George brought me this opportunity with remote therapeutic monitoring, boy, this really resonated well with me. So the 3 steps to success with community pharmacies starts with seniors home services and remote therapeutic monitoring. RTM is a program that only started in 2022, so it's fairly new program that Medicare has established for patients to do a lot of preventative health services. And so it's an exciting opportunity for our pharmacies to get involved with Zero Startup. And George is going to tell us all about that program. We're going to just touch on step 2 and step 3. Step 2 is going to be getting credentialed to get into the payer network, so that expands your scope of services. And then step 3 is a fully managed and run clinic for you. It's a brick and mortar clinic. That's a BRIM wellness program. You can do step 1 and 2 independently. You can do them at the same time. You just can't do step 3 without step 2. So George, why don't you take us through the opportunity with RTM?
Sure. Well, thanks, Breck, and thanks everybody for joining us. My name is George Veronis, and I'm the Vice President of Sales and Marketing for Seniors Home Services and also the presenter of this program. And if you're a pharmacist out there, we've gotten great reviews from the pharmacies out there because they are looking for additional money. And also what's really powerful about this is first and foremost, you have a big impact on your patient base of seniors. So if you look here to the left of the screen, the program that we have several programs that are under this remote therapeutic monitoring, and they're going to help your patients with memory, balance, cognitive issues, stress, decision-making, quality of life. And one of the reasons Medicare is willing to pay for that is because, for instance, just someone falling, it cost them, $30,000 on those injuries, and they spent $31 billion last year just on that alone. So Medicare is encouraging people to do this, especially the seniors. And we were taking this like directed only to the doctors, but now the pharmacists could do an administrative fee and get a service fee for that. It's nothing to do with if you have Medicare or not, because it's under our NPI number, and you spend about a minute on a patient, which you'll see in a second. In return, you receive $25 per month per patient. So our goal in every pharmacy is at least 100 of the seniors, and that would make you $2,500 of pure profit. Everything's turnkey. You don't need to add additional staff, no capital investment at all. So it's a really solid program. So I'm going to show you a series of videos. These are all like 1 to 2 minutes long to give you a good idea of what we do. So I'll start with the one on the pharmacy, since that's what we're doing.
It's no secret that pharmacies are under financial stress today and need to find new sources of revenue within their existing businesses. Seniors Home Services is happy to introduce you to our Remote Care Today program that can provide tremendous benefits to your customers and new revenue for your pharmacy. Our remote care service is clinically proven, done over tablet or smartphone, and a Medicare reimbursable program that can help prevent, treat, and often reverse chronic illness, musculoskeletal disorders, memory loss, cognitive regression, and loss of balance, thereby slowing decline while helping prevent falls and loss of independence. Our remote care services are backed by years of success in improving patients' quality of life, helping them remain independent for as long as possible. You can make these services available to your patients as we provide a turnkey solution, including patient engagement, enrollment, support, and Medicare billing under our Medicare NPI. Our patient engagement process is easy and fun with our complimentary Turn Your Selfie into a Healthy app and does not require any additional work for you or your staff. This biometric facial scanning app, which we personalize to your pharmacy, uses smartphone facial scans to read blood pressure, heart rate, oxygen levels, and risk factors with incredible accuracy, engaging patients in their own health by knowing their numbers anytime, anywhere. We also provide posters and bag stuffers with QR codes. As people use the app and receive results, they naturally engage with our support team and learn all about how our services can improve their quality of life. Information on your patient's monthly progress will be available in our secure portal. And if you choose to review their assessments each month, you can earn administrative services fees for the time you spend, all while helping your patients live better and longer.
So that gives you a little bit of idea of the overall program, and we really concentrate on 3 buckets with remote care. And Breck, I'll let you cover this on what pharmacies could really take advantage of.
Yeah, so there is also the chronic care management and remote physiological or remote patient monitoring, along with the RTM or remote therapeutic monitoring. Not one service provider can do all 3 services and bill Medicare for it. So one of the advantages of working with Seniors Home Services is that they are collaborating different providers to bring in these additional services. So you as a pharmacy can offer all 3 services and they be provided by different providers. So we're going to spend the majority of the time really focused on the remote therapeutic monitoring because that's the lowest hanging fruit to get started. But just know you can add these additional services along the way after you get set up with RTM.
Right, but to keep it simplistic right now, where the pharmacy is probably 95% are focused on RTM, and where we're getting a lot of. So I'll play you a little video on RTM to give you an idea. There's a little bit of repetitiveness on the selfie healthy, but it'll give you a good idea what RTM actually is.
Remote therapeutic monitoring, RTM, is a clinically proven and Medicare reimbursable program that not only helps recovery from accidents, but can be directed to help prevent and often reverse memory loss, cognitive regression, and loss of balance, thereby slowing decline and helping prevent falls, as well as helping with stress, anxiety, working memory, concentration, decision-making, and emotional control. In addition to the physical improvements patients can see, these programs can improve plasticity, which will improve patients' quality of life, helping them to remain independent for as long as possible. We are pleased to make RTM available to your patients and make it so easy as we provide a turnkey solution, including patient support and Medicare billing under our Medicare NPI. Introducing RTM to your patients is easy as we do the entire introduction and education for them. We'll send them a landing page, which can include a short video message from you, as well as educational videos, and then give them the opportunity to enroll right there. We'll also reach out by phone to assist with the enrollment process. When they enroll, our coaches personally call by phone to welcome them and send a welcome email with logins to their personal customized programs. Their personal coaches are available by phone as needed to help them along the way. As with all our programs, we take care of all patient support, coaching, encouragement, and all billing. Remote therapeutic monitoring can have a major positive impact on your patients without creating any additional work for you or your staff. Just click the Get Started button on this page to begin.
So bottom line is we have several programs, and I'm going to show you a little video on one of them. So what we have, if we build a platform, an RTM platform, and on that there's several different programs that the seniors could choose from and help them with cognitive issues, balance. We do an assessment when they get on, or they do the assessment, and then from that assessment, we'll gear them to specific programs. So there'll be 3 or 4 or 5 different programs that could change every day. They could do different functions of it. And then every month they get an assessment and evaluation to show improvement. And, they could do it for as long as they want, and Medicare will cover it as long as we're monitoring it. So let me show you one program and just give you an idea.
Brain Savers is a pioneering evidence-based lifestyle program designed and developed to promote healthy brain aging and reduce the risk of what is currently the 5th leading cause of death, and that's Alzheimer's disease. I'm Dr. Paul Bentheim. I'm a neurologist, and I led the development of the Brain Plus Body Total Lifestyle program.
I'm Dr. Gina Touch Mercer. I'm a geropsychologist. My name is Angie Moore. I'm programs manager for Brain Savers. I make up several of the brain workouts and many of the lessons on cognitive fitness, socialization, and stress management. My focus is developing the physical fitness aspects of the class, as well as the segments of the class that have cognitive and physical exercises combined.
This curriculum was designed and developed to enable aging Americans to live an enriched lifestyle in place while reducing the risk of Alzheimer's disease.
You can't function well unless you're feeling well. And when you're feeling poorly, it will affect your brain function. We use the science of positive psychology to construct our lessons and our activities to help people function better.
The program we developed is evidence-based. This means that we use published research studies to develop everyday engaging brain and body workouts.
So what we do is make activities that really are building new connections and new nerve cells or brain cells so that older people can function more effectively, they can remember better, and they can have a better quality of life because their brain is functioning better. Being physically fit is the #1 way that you can protect your brain, make it more healthy, and guard against dementia and Alzheimer's. When you exercise, you are pumping oxygenated blood into your brain. So let's do that again. Big inhale, letting the air come in.
So again, you could get an idea, and you could see more of this. But the reality of it is, at the end of the day, we make sure that we're really working on the different skill levels or different areas that senior needs. So again, working memory recall, response time, balance, falls, early discovery of dementia to help prevent it, stress management, etc. So every exercise is different. And what's interesting, it's only 8 to 10 minutes per day. And as long as the senior is doing it 16 days, half of the month, then Medicare will cover it, and both Medicare Plan B and on Advantage plans. So, and we do a lot of reminders, there's games, there's a lot of engagement in it to keep the seniors to do it for long periods of time and for months that make a big difference. So again, we have a new platform coming out very shortly. That's going to even be more robust to show a lot of different things, and you'll be seeing that probably in the next few demos. Then the other question is, how much work is it for the pharmacist? And again, remember, we're marketing to your database. we're providing the bag stuffers. If you give us your database, we'll obviously call them, like I said, email them. We remind them if they're not on. So you don't have to be, as a pharmacist, engaged, but you do have to do an assessment at the end of every month for at least a minute on each patient. So this is pretty much all you have to do.
Working with our program is easy for you and your staff. If you choose to review your patient's monthly progress and earn administrative services fees, you will be sent a weekly email notification reminding you to log into your portal and review patient assessments. You or an appropriate member of your staff will review these reports, review the summary data for the patient, add your notes, and then simply click the sign-off box next to the record. It's that easy, and it's that fast.
So like Breck likes to say, basically, if you have 100 patients on this and it's taking a minute to check the box, write a quick note, look at the review, that's basically 2 hours a month, which breaks down to about $1,200 a month per hour for your services. So, but the more important thing is you're going to get a lot of compliments, a lot of accolades from your patients. They're going to love it. And one pharmacist said to me, wow, what a blessing that we could really help our patients, and our senior patients especially, and economically still support our family by getting a nice admin fee. So again, $2,500 to $5,000 pure profit, depending on the amount of people you put in. And then, as we said in the one video, we have a lot of engaging tools. This is a new one called Turn Your Selfie into Healthy. And what's nice about it, right in the middle here, we're going to also have a video from you, the pharmacist, for 20 seconds saying, hi, I'm Dr. Jones. I evaluated this great program to help you with your cognitive issues. You're following your balance. I would click here and watch the video. And if you like what you see, then you can enroll and start the program. Medicare covers it, something like that. And if that's coming from you, the pharmacist, to the patient, obviously we'll get a way better response. And it's all set up with a lot of automation. So I'm going to skip this video because it's pretty much what you've seen on the Selfie Healthy. And I'll just end it by saying, what do you do next? How easy? And I know this is kind of short presentation, but this is all it really is, right? Administrating it. We engage your patients, and then basically here's what you need to do in the last step.
They feel seconds after taking their selfies about our remote care program, about their Medicare health and wellness programs that also improve balance, memory, and quality of life. To get started, your next steps are easy. First, complete our agreement and sign the BAA, which ensures HIPAA compliance, and then we'll schedule your onboarding meeting. During this meeting, we'll discuss how we engage patients and the materials we can print and provide you that help patients engage with us. We will then educate and onboard your patients using approved text messages, emails, and friendly phone calls, providing the patient the appropriate programs and coaching, all without any cost to you. Your pharmacy then has the option to provide monthly data reviews for each patient, which earns you monthly administrative service fees. Better patient health, new revenue for your pharmacy, improved patient loyalty. Let's get started.
So again, you'll get paperwork that you can look at, and then we just do an onboarding call, which means that we get to you and we show you exactly how the program will be engaged into your patient base. You agree with us, whatever you'd like to do, and then we get started. So it is that simple. So Breck, I'm going to go back to you because that's the initial profit-making system with helping the patient. But I know for the long run, getting credentialing and medical billing is really key for these pharmacies. So I'll let you cover the last two steps, and then we'll wrap it up.
Yeah, so this is step 2 in clinical services for community pharmacies. And I can assure you, after visiting with hundreds of community pharmacies that have attempted to set up clinical services, there are certainly more wrong ways of doing it than right ways. And these 4 pillars are the pillars to success of doing it the right way. They all are also the pillars for failure if it's not done the right way. And the first pillar is having a turnkey patient engagement tool, the software solution, in order to track, schedule, bill, do your clinical notes, all of that all in one place. You need to have that in place, and IPPN provides that for you. And unlike all of the electronic medical record platforms out there that pharmacies would have to purchase and pay a big expense to that, or have a monthly licensing fee of $400 or $500 a month. This is part of the service. They give you that platform at no additional cost. The second pillar is collaborative practice, or CPA. You've got to have a collaborative practice agreement in place because a doctor, an MD, or in some states, a nurse practitioner needs to they need to manage the care plan for each patient. And then the third pillar is, that recruiting of it. So you may have a doctor or two that you already work with. That's great. They would be the easiest ones to approach in partnering with first. But IPPN will actually help you recruit the other doctors and providers. And let me tell you, they want to work with you because of the tool that the founder of IPPN created, that shows a report card on each provider, showing them the services that Medicare wanted to pay them for, but they just haven't gotten around to those services yet. Well, your pharmacy can partner with that doctor to pick up those care gaps or fill those care gaps and take care of those patients better. And then the fourth pillar, of course, is the payment and billing and collections piece of that. One of my pharmacy clients that actually got in network with another service provider that helped them get credentialed, they started doing billing, and they couldn't collect on the bills. They literally have over $100,000 worth of medical bills that they haven't been able to collect on, and so now the IPPN is helping them with that. This is just some examples of the CPT codes that are being used with the clinical service with IPPN. So all of the virtual visits, those preventative visit codes can go along with like something as simple as a flu shot, right? So if you do a flu shot, PBMs are only paying you $17 to $25 for that flu shot. Well, you can turn that into a preventative visit and actually get reimbursed over $85. And then there's office visits, and then also the diagnostics as well. And then the third step, we're just going to lightly touch on this because, of course, you have to have step 2 in place before you can even think about step 3. But Brim Wellness is completely managed and staffed for the pharmacy. The pharmacy owns it. But this is a full clinical, physical, clinical build out, and with a talent exchange, which is amazing because it's kind of like Uber for nurses. So the pharmacy isn't stuck paying for an FTE if you don't have any clinics that day. You only bring in a clinician to see the patients when you have patients to be seen. And the third piece of that is the financial vehicle, which is a pharmacy fund. Your pharmacy can participate in that and help other community pharmacies get set up and then earn a fair interest rate on your funding there. So back to you, George.
Yeah. So anyway, guys, that's the 3 steps. And at the end of the day, you're going to help your patients enormously with a lot of the issues you see here on the left. You're going to make a nice profit, and you're going to be into medical billing. And again, Medicare is covering it all. So anyway, that's all we have. We want to just keep this short, get the point. What I would do is get back to the person that invited you on this. They'll get you the contract. They'll answer any other questions you have. And we can stay on for a couple of minutes, or Brett can, and we'll answer any questions. So thanks. And Brett, I'll put it back to you if you want to open it up.
Yeah, appreciate it. And thanks everybody for joining us this afternoon.